Welcome to our channel. Today we are going to learn how to talk to a dentist about a tooth problem. It's a situation many people fear, but having the right vocabulary helps.
Absolutely. I actually have a dentist appointment next week, so I need this masterclass just as much as our viewers do. Let's drill into it.
The first thing the dentist will ask is, what kind of pain is it? You need to know the difference between sharp, dull, and throbbing.
Ooh, I know this. Sharp is sudden, like a needle. Dull is a low, constant ache. And throbbing?
Throbbing is like a heartbeat in your tooth. It usually means an infection or heavy inflammation. You also need to point out exactly where it hurts. We often talk about the molar teeth in the back. So I can say, it's the upper right molar? Perfect. Or the bottom left molar. Being specific saves time. Sometimes it doesn't hurt all the time, only when you eat or drink. This is called sensitivity.
Yeah, like when I eat ice cream. I should say, I have sensitivity to cold foods.
Exactly. Or it hurts when I drink hot coffee. That reaction is a key clue for the dentist. The most common diagnosis is a cavity. That is a small hole in the tooth caused by decay. And the fix for that is usually a filling, right? Yes. The dentist cleans out the decay and puts in a filling to restore the shape. It's a very standard procedure. It's not always the tooth. Sometimes it's the gums. If you see pink in the sink, you might say, "My gums bleed when I brush."
That sounds serious. Does that mean I'm brushing too hard?
Maybe, but it often indicates gingivitis. Healthy gums shouldn't bleed easily. All right, Mark, let's role play. You're the patient, I'm the dentist. Describe a long-term pain.
Hi, doctor. I have a dull ache in my lower jaw. It's been bothering me for a week.
I see. Is the pain constant or does it come and go?
It's constant, especially at night. So, if the cavity is really big, is a filling enough?
Good question. If the tooth is too damaged, you might need a crown.
A crown? Like for a king?
Sort of. It's a cap that covers the whole tooth to protect it. It's stronger than a simple filling. Before they start drilling, they will give you a local anesthetic.
That's the shot, right? The part that makes you feel numb?
Yes, being numb means you can't feel pain, but careful, you might drool a bit afterwards.
I always talk funny when I'm numb.
To see what's happening under the gum line, the dentist will say, "We need to take an X-ray."
That's to check the roots in the bone, right?
Exactly. An X-ray reveals hidden issues like infections or bone loss. Now for the scary vocabulary. If the nerve is infected, you might need a root canal.
Yikes. And if it can't be saved?
Then it's an extraction. But dentists always try to save the tooth with a root canal first. The best way to avoid all this is protecting your enamel.
Enamel's the hard outer layer, right? So I should brush and floss daily.
Yes, flossing removes food from between teeth where the brush can't reach, keeping your enamel strong. Let's do another role play. This time, ask about that pressure in the back of your mouth.
Doctor, I feel a lot of pressure in the very back. I think it might be my wisdom tooth.
Let's take a look. Does it hurt when you chew?
Yes, and the gums back there feel swollen.
After a procedure, the dentist gives post-op instructions.
This is important, like don't use a straw or change the gauze.
Precisely. Following these rules prevents infection and helps the gums heal faster. Finally, let's talk about tone. Instead of saying, "I have pain," try, "I've been having some trouble with my molar."
It sounds more natural. Or, I've noticed some sensitivity lately.
Exactly. It's polite and gives the dentist a clear history of the problem. Let's recap the top 5 essentials for your next visit.
1. Describe the pain, sharp, throbbing. 2. Point to the molar. 3. Mention sensitivity.
4. Ask if you need a filling or a crown. And 5. Don't fear the root canal.
Thanks, Emma. My appointment next week won't be so scary now.